therefore move to the next agenda item, looking at the roadmap to accelerate the elimination of cervical cancer as a public health problem in the WHO European Region 2022-2030. And here too we have a number of documents which have been submitted to help guide our debates. To try and move quickly, I will immediately turn to Dr. Nino Berzulli so that she may share with us her introductory remarks, and I will ask her to be brief given the time situation.
Thank you very much, Chair. Distinguished ministers, honored guests, and dignitaries, please allow me to introduce the regional roadmap for elimination of cervical cancer as a public health problem. A few brief remarks with regard to the situation in the WHO European region. Every year in the region, more than 66,000 women are newly diagnosed with cervical cancer, and more than 30,000 will die from it. And there are considerable disparities in the incidence and the mortality across the region. And this happens despite the fact that cervical cancer is preventable and curable disease. As you all know, in 2020, the World Health Assembly adopted the global strategy for elimination of cervical cancer as a public health problem and committed for the first time to eliminate a type of cancer that causes such a devastation to individuals, families, and the society. To make elimination reality in the WHO European region, we have developed, in consultation with you, the regional roadmap for elimination of cervical cancer as a public health problem that contextualizes the global strategy in a way that it responds to the needs of all member states in the European region. The regional roadmap for elimination of cervical cancer has three key pillars. First is ensuring the universal and equitable access to HPV vaccination, ensuring quality and organized cervical cancer screening, early diagnosis, quality treatment, and palliative care. And of course, it goes without saying that we won't be able to implement this elimination agenda in our region without your commitment and investments. We will be able to eliminate the cervical cancer as a public health problem by only putting the people at the center of our efforts, investing in communication and reducing the disparities, strong community engagement, engaging the target audience in co-designing effective solutions in terms of the implementation of known solutions, investing in the care pathways, building strong health workforce capacity, and strengthening the partnerships to better disseminate the evidence-based practices. Putting people at the center of our efforts will require, first of all, listening to their voices as we embark on the path towards the elimination of cervical cancer. And many of you will recognize the face of Laura Brennan, who died at the age of 26 in 2019 from cervical cancer. She was a strong advocate for HPV vaccine, and she would have been 30 this September. But her message still resonates to us, and now I would like us to see the video that brings her parents, Laura and Bernie Brennan, to address us.
I always hoped that my daughter would look after me in old age, which unfortunately I will never experience that. There is a lot of things as parents we will never experience. She's my only daughter.
Yeah.
I will never get the opportunity to walk her up the aisle.
unfortunately, that's all robbed from her and from us. Sorry.
We're just two ordinary parents.
Talking from experience.
Talking from an experience where we lost our daughter, and we regret that we could have saved our daughter if she had got the vaccine, if we had known about the vaccine.
When our children are born, we all hear about the vaccinations our children have to get, the MMR, their boosters, but unfortunately we don't hear about the ones they should get when they reach their teenage years. Unless systems have changed since our children were small, we don't hear about the HPV vaccines.
We would feel that our mission would be over if people would take the vaccine and we'd no more hear about HPV. That'd be a thing of the past. Wouldn't it be a lovely thing to eliminate?
Cancer it's a desperate disease, and we all say it won't come to our door. It's something another family gets, but until it comes to your door, you don't realise the importance of all these vaccines.
It won't work on its own. We need to put in place an awareness campaign that will show the value of it, that will show the alternative to this vaccine. And we are the alternative to this vaccine. We are a family that lost our daughter.
The HPV vaccine saves lives. It could have saved hers.
We've done our best, but it's a wider problem that has to be solved, not by us, by other people. It's important that ministers for health and governments throughout the world would make families aware of the value of it, that lives could be saved if they took the vaccine.
I want to thank Bernie and Larry Brennan for sharing their experience and for their tireless efforts and of their daughter in drawing attention to the importance of the HPV vaccine and the need to ensure uptake through policy, effective communication and education. Next, I'm pleased to welcome Dr. Dilyara Kadyrova, Director General of the Kazakh Institute of Oncology, to talk about the important achievements in Kazakhstan in terms of the implementing the cervical cancer screening program, and ask her to share her experience and the reflections on how Kazakhstan is ensuring the uptake of the cervical cancer screening, particularly among the hard-to-reach populations, the vulnerable groups.
Dear chairs, dear Nina, in Kazakhstan we started our national cervical cancer screening program in 2008 using WHO guideline recommendations. Appropriate database help us to analyze the coverage and to take all necessary actions. To achieve best results, it must be strong professional team, including a well-trained nurses, cytologists, gynecologists, and oncologists. After the implementations, we of course have had barriers, for example, among Muslim women who often gave birth in large families and have no time to visit doctors. In this regard, we have developed communication programs aimed at explaining the screening goals by involving NGOs. We started to use mobile medical complexes to rural areas where young girls and their mothers can get screening. Such strategies have increased the participations of Muslim women in screening. In addition, we would like to introduce HPV self-sampling testing for them. During these 12 years in Kazakhstan, we increased our coverage for participating for 80% during these years. A significant decrease of mortality, increase the detections of precancer lesion, and increase the 5-year survivals of our patient. And of course, all efforts should be aligned to eliminate cervical cancer in our country. Thank you.
Thank you. Thank you very much for emphasizing the need to bring the services closer to the population and making and ensuring putting the people at the center of our efforts. With this, I would like to close this introductory part and just say a few words about importance of eliminating the cervical cancer in the European region. We are charting today the new future, future free from cervical cancer. And we have to do everything possible in our hands to save those that we can. Let's make elimination of cervical cancer our legacy. Thank you.
Merci beaucoup, Nino. Merci
Thank you,
beaucoup,
Nino.
Dr. Kaidarova.
Thank you to Dr. Kaidarova also.
Nous allons passer maintenant
We
au
will
débat
now
et j'ai
move
évidemment
to
l'honneur de
the discussion,
redonner la conduite des débats à
and I'll
notre
hand
président, Monsieur
over
le ministre.
the chairing to our President Minister.
Merci beaucoup. Donc, on commence
Thank
avec
you
le
very much.
débat,
So we're going to
avec
begin
la
our
liste des
discussion.
États
So we're going
membres.
to start
Donc,
with the list of member
premièrement,
states.
la Pologne,
So
suivie
first
par
of all,
l'Espagne.
Poland, and then we'll have
Pologne,
Spain.
s'il vous plaît.
Poland, you have the floor.
Non. Donc, l'Espagne.
So Spain.
Vous êtes prêts?
Spain, are you ready? Go for it.
Thank you, Chair. Spain aligns with Czech Republic on behalf of the European Union and its member state statement. My country supports the draft resolution roadmap to accelerate the elimination of cervical cancer as a public health problem in the WHO European Union 2022-2030. Spain can boast of having one of the highest vaccination rates in the European Union and in the world for vaccines included in the national vaccination calendar. The approach to cervical cancer focuses on a comprehensive approach to the disease, investing large resources in prevention through vaccination and screening and treatment of this disease. In recent years, our vaccination coverage against human papillomavirus has remained above 80% in adolescent women. And we are currently evaluating the introduction of vaccination against HPV in adolescent males as well. Regarding our efforts in screening, the implementation of a systemic screening of cervical cancer is a key pillar. The human papillomavirus detection test has been incorporated into our national health system as a primary screening test in part of the target population. It is expected that within 5 years it will reach at 100% of target population. With this strategy, we look forward to keep and down the low incidence of cervical cancer in Spain. We have established the cancer strategy of the national health system, which does not focus on specific cancer subtypes, but advocates a comprehensive approach to any cancer patient through multidisciplinary care as a proposed care model to meet the challenge of coordination between professionals and the centers involved in the diagnosis and treatment. It is included among the priority action of the strategy to maintain the process of updating and adapting both technology and oncology professionals to the future demand of cancer patients. Thank you, Chair.
Merci beaucoup, l'Espagne.
Thank you, Spain.
Donc, maintenant, on passe à la
Now we will move to
Tchéquie, qui
Czechia,
représente les États de l'Union européenne,
representing the EU
suivi
member
par la
states,
Fédération russe.
followed by the Russian Federation.
Voilà, s'il vous plaît.
Czechia, please.
Honorable Chair, distinguished Regional Director, Excellencies, colleagues, I have the honor to speak on behalf of the European Union and its member states. The European Union and its member states thank the Secretariat for drafting the roadmap to accelerate the elimination of cervical cancer as a public health problem in the WHO European region 2022 to 2030, as well as of the related resolution. We recognize the unique chance to eliminate this type of cancer as a public health problem in the WHO Europe region by optimizing the use and the availability of HPV vaccinations through regular screening and state-of-the-art treatment for all target groups, and to reduce thereby the burden of disease also for other cancer forms caused by human papillomaviruses. Accordingly, we support both documents and will do our best to implement them in line with our nationally set priorities. In doing so, we will draw on behavioral and cultural insights to overcome, in particular, socio-economic and cultural barriers, and pay special attention to the related aspects of target group-specific communication, information, and health literacy. The EU remains committed to the promotion, protection, and fulfillment of all human rights and to the full and effective implementation of the Beijing Platform for Action and the Programme of Action of the International Conference on Population and Development and the outcomes of their review conferences, and remains committed to sexual and reproductive health and rights in this context. Having that in mind, the EU reaffirms its commitment to the promotion, protection, and fulfillment of the right of every individual to have full control over and decide freely and responsibly on matters related to their sexuality and sexual and reproductive health, free from discrimination, coercion, and violence. The EU further stresses the need for universal access to quality and affordable comprehensive sexual and reproductive health information, education, including comprehensive sexuality education and healthcare services. We consider vaccinating also boys, wherever feasible and appropriate, as an important element for ensuring widespread prevention, not only of cervical cancer itself, but also of other forms of cancer caused by human papillomaviruses. We are confident that the WHO European region can reach the ambitious goals set forth in these two documents, and that it will become a model region for the elimination of cervical cancer and related forms of cancer by 2030 if we implement effective and evidence-based measures in line with the roadmap as a guiding document. Thank you.
Merci la
Thank you, Czechia. The floor now goes to the Russian Federation, followed by Turkey.
Спасибо, господин председатель. Профилактика, своевременная диагностика и лечение рака
and the treatment of cervical cancer is one of the priorities of Russian healthcare, which is underlined by Russia's activity as the co-sponsor at the WHO on the resolution for eliminating cervical cancer. That's WHO 2020. We believe that we need to accelerate the activities organized for screening, diagnosing, and treating cervical cancer, as well as treating cervical cancer in situ. The Russian Federation, as a system of giving responsibility to the population, is establishing a system of diagnostics in order to do early screenings of various forms of cancer, including cervical cancer. In a number of Russian regions, there is a free vaccination programs for girls. We have also set up a vaccination campaign within the national vaccination calendar. The Russian Federation supports the adoption of this resolution.
Très bien, merci.
Thank you very much.
Et donc maintenant on passe à la Turquie, suivi
So
par
now we will move to Turkey and then Israel. Turkey.
Thank you, Chair. We commend Secretariat for such a valuable and ambitious roadmap document to accelerate the elimination of cervical cancer in the European region. Turkey is conducting a screening program for cervical cancers based on HPV DNA screening, with covering 80% of women in target age groups. No need to say, of course, screening program includes treatment of HPV positive cases and quality control measures. Yet, we are aware that success of this national program may be enough to save women from unwanted consequences of cancer, but it's not enough to eliminate this public health concern. The problem is HPV vaccination cost is still very high, and we request the regional committee takes note of the equitable and affordable access to HPV vaccines for all member states in the region, and especially for the middle-income countries, and requests from the Secretariat to work closely with member states on country-tailored, efficient vaccine access, delivery, and procurement modalities to make introduction of HPV vaccination into national immunization programs. Turkey welcomes the resolution. However, the latest amendments inserted into operative paragraphs as responsibility of member states regretfully makes us to claim Turkey to be disassociated from this resolution. Thank you, His Excellency.
Merci la Turquie.
Thank you, Turkey.
Maintenant, j'ai l'honneur à donner la parole à Israël,
The honor to give the floor to
à
Israel.
Dr. Sharon Alroy-Price, qui
Dr. Sharon
dirige nos
Price,
efforts sur la
who is
santé
guiding
publique.
our efforts on
Voilà
public
Sharon,
health.
puis
Sharon,
suivi par la Géorgie.
by Georgia.
Allez-y, s'il vous plaît.
Go for it.
Thank you, Chair. The State of Israel Ministry of Health welcomes the publication of the roadmap to accelerate the elimination of cervical cancer as a public health problem in the WHO European region 2020 to 2030. Cervical cancer is unusual among cancerous lesions in that it is almost entirely preventable, largely detectable via screening, and effectively treatable by proven intervention. Israel has low and stable rates of cervical cancer diagnosis, but relatively high mortality rates by European and American standards. HPV vaccination is given free of charge at schools to 12 to 13-year-old boys and girls, with the possibility of free catch-up until age 18. Unfortunately, the uptake is suboptimal, largely due to resistance based on religious and moral grounds. Currently, the vaccine is also offered to 21 to 26-year-old men and women, but there is a gap in that coverage for those aged 18 to 20. Israel offers free screening for women aged 25 to 54 once every 3 years based on HPV high-risk typing. The screening is monitored via national quality measures programs, but only about half of women perform screening at the recommended interval, with a high imbalance between higher and lower socioeconomic level. In Israel, more than 40% of cervical cancer cases are detected in women above age 55. Abnormal HPV cytology findings are investigated and treated according to Israeli Society of Colposcopy guidelines, which are similar to European and American guidelines. Given the current situation, Israel still has more to do. Treatment of cervical cancer is given by multidisciplinary teams based on international recommendation. Palliative treatment is offered at gynecology units and oncology departments, but also at home by community healthcare services, with prevention and pain elevation as a major aim. In order to improve prevention of cervical cancer, organized screening and extension of screening till 65 years old should be considered. Israel plans to improve communication and encourage young people to get HPV vaccine, and free catch-up vaccine till age 26 should be considered, as in many European countries. Thank you.
Merci Sharon.
Thank you, Sharon.
Maintenant, je passe la parole à la Géorgie,
The floor now
suivie
goes
par
to
l'Ouzbékistan
Georgia, followed by
via Zoom. Donc,
Uzbekistan on
préparez-vous,
Zoom.
Ouzbékistan.
So Uzbekistan, get ready.
Voilà. La Géorgie.
Dear Chair, distinguished delegates, Georgia expresses its highest interest and willingness to join regional efforts aimed at cervical cancer elimination. Georgia's cervical cancer interventions are fully aligned with the World Health Assembly's resolution calling for elimination of cervical cancer as a public health problem passed in August 2020. Over the last several years, Georgia has established the infrastructure and introduced the mechanisms to promote access to affordable screening, diagnostics, treatment, and palliative care, as well as to introduce HPV vaccination to reduce the risk of cervical cancer. Ministry and the National Center for Disease Control and Public Health are currently working on developing the integrated national strategies and plans with country-specific targets towards cervical cancer elimination. The Cancer Screening Registry has been operationalized to better coordinate screening efforts by linking surveillance and screening data. In 2021, the government announced the expansion of the groups of cancer medicines covered by the Universal Healthcare Program to ensure access to novel drugs and effective treatment options.
In order to increase the HPV vaccination coverage, Georgia prioritized gender-sensitive HPV vaccination approach in girls as the most effective long-term intervention for reducing the risk of developing cervical cancer and made steps towards strengthening vaccine supply and access. Since 2019, the HPV vaccine is included in the National Immunization Program for girls aged 10, 11, 12 years. In order to improve the vaccine coverage, since 2022, HPV vaccination is done in girls aged from 13 to 18. Efforts are in place to engage stakeholders from different sectors, communities, and to access hard-to-reach communities, including migrants, ethnic minorities, and other vulnerable groups. The government of Georgia implements cancer education program. This is part of a comprehensive health promotion program aimed at building cancer awareness in general public and high-risk groups. The program employs talk and test methodology to encourage cervical cancer screening. An interactive web page is being developed for real-time cancer-related counseling. In conclusion, we express our full support to the roadmap to accelerate the elimination of cervical cancer as a public health problem in the European region for 2020-2030. Georgia will undertake all necessary steps to accelerate the elimination of cervical cancer by investing in screening, HPV vaccination, early diagnostics, and effective treatment. Cervical cancer is the only cancer the world can truly eliminate. So it's really time to do it now. I thank you, Chair, for your attention.
Thank you very much to Georgia, and I now give the floor to Uzbekistan via Zoom, followed by Austria. Are you connected, Uzbekistan?
Уважаемый господин председатель, уважаемые главы делегации, гости, участники заседания, прежде всего, позвольте
allow me to thank you for giving me the possibility to take part in the work of the 72nd session of this session of the Regional Committee. Cervical cancer is the fourth largest type of cancer found amongst women. 90% of the cases are connected with the HPV virus, but we can use vaccination to protect women and men. Every year in our country, we identify 1,800 cases of cervical cancer in our country. This is a type of cancer that is very common amongst women. We have strong political will in our country, and thanks to the efforts of the President, we have been able to take effective measures for early identification, and our efforts have been crowned with success. I point out that Uzbekistan was chosen as one of the main countries that supported the efforts to eradicate cervical cancer. In 2017, the Cabinet of Ministers of Uzbekistan developed a national plan of action on the prevention of cancer, which includes a whole array of measures to eradicate cervical cancer. At present, with the help of the WHO, we are continuing to update our national standards, and we are also developing models for early identification and also the provision of care for children with cancer. As of November 2019, together with the WHO, we are implementing a pilot program for screening for cervical cancer, together with the UN Population Fund, UNFPA, and we are also receiving support from Japan and the Embassy of France to Uzbekistan. In this program, we are using cutting-edge technology to identify the presence of cervical cancer in 2 regions of Uzbekistan. As part of our fight against cervical cancer, we have started rolling out a vaccination program for HPV for girls. The results that we achieved in 2021 are very positive. positive indeed, and there has been a good uptake of vaccination amongst girls. But we are not going to rest on our laurels. No, no, no. We will continue to undertake every possible effort in order to ensure that we make success when it comes to the timely identification of cervical cancer and when it comes to rolling out appropriate care to people. Ladies and gentlemen, in conclusion, allow me to thank the European Regional Office of the WHO for the permanent support given to our country. I reiterate the commitment of my country and my health ministry to implementing the global strategy to eliminate cervical cancer. Thank you for your kind attention.
Merci beaucoup.
Thank you very much, Uzbekistan, for your statement. Now, I do apologize because I forgot Slovenia, so now we will give the floor to Slovenia, and then we'll move on to Austria. Slovenia, you have the floor. Please go ahead.
Thank you very much, Chair. Slovenia aligns itself with a statement made by Czech Republic on behalf of the EU. Slovenia welcomes the regional roadmap on cervical cancer elimination and its emphasis on organized population-based screening as part of a pathway. Speaking from experience, we can see the clear benefits of investing in organized screening. Slovenia established a national cancer registry in the 1960s, which enabled us to track cervical cancer incidence. Despite the few decades of opportunistic screening, we observed an increase in the incidence in the 1990s. After implementing organized screening and increasing its coverage among the target population and ensuring follow-up and quality services at all levels, Slovenia became one of the countries with the lowest cervical cancer incidence in Europe. We can prevent almost every case of cervical cancer with vaccination, screening, and treatment. Screening plays an important role in this equation. We should not allow that our people die from a disease that is preventable and should strive to implement organized screening as best possible services on the continuum of cervical cancer prevention and care in all member states. Slovenian example shows that this can be done. With shared vision, engaging all stakeholders, following the evidence, strong governance, monitoring and adjusting, and the success is measured in people's lives. We look forward to working collectively with our colleagues to eliminate cervical cancer in our region. I thank you for your attention.
Thank you very much to Slovenia. So now we will go to Austria and then Ukraine, and then we'll have international NGOs. Right, Austria. Please go ahead.
Vielen Dank.
Thank you
Österreich
very
schließt sich der
much.
Wortmeldung
Austria
der
endorses
EU und
the
ihrer
statement of the
Mitgliedstaaten
EU and its
an.
member states that was made by Czechia. We welcome the plans of the WHO to eliminate cervical cancer as a threat for public health by 2030. To this end, we do not need just curative approach, but we need to have a continuum of primary prevention involving early identification and clinical treatment going as far as palliative care. Service provisions alone, such as the availability of a vaccine or screening, do not, however, mean that people actually take up those services. They may not want to, or they may not be able to. This can lead to a markedly worse health outcomes. In order to increase HPV awareness and awareness about cervical cancer and to increase uptake of relevant services, there is a need to have intensive intersectoral collaboration, including in the field of education and in the social field, to raise awareness among school children in time and also their parents and teachers about this topic. Moreover, we need to have a transparent outreach work that targets target groups, and target groups must include all people who have any impact to bear on health behaviours. To this end, the regional office can support member states with recommendations. Awareness raising and HPV vaccination must take place in a gender-neutral way, as is the case in Austria. In this way, we can break infection chains of HPV and we can reduce the burden of disease of other types of cancer caused by HPV, regardless of gender. Moreover, it's important to strengthen the role of health literacy by providing information in an easily accessible way. And it is also important to ensure that we have appropriate and well-organized advice and counseling services. We must focus our attention on groups of the population with low participation rates in preventive health services. This includes people with limited socioeconomic status, for example, and also people with low formal levels of education, as well as the vulnerable groups. Particular attention must be placed on transgender individuals as well as non-cisgendered persons. An important accompanying measure is the participative health service and implementation research. This can be very useful when it comes to identifying target-specific barriers, and it can certainly help us to tailor our approach accordingly. On the whole, it is important to ensure that all political measures are informed by the best available evidence. To this end, we need to have reliable data. When it comes to data generation, we need to ensure that there is no overlap. Thank you very much. Thank you very much, Austria, for your statement. And now I will give the floor to Ukraine. I see that no one is here in the room right here. Would any member states like to take the floor at this stage? No. No? Okay. So we will now move on to the organizations, the IGOs. We've got the EU Commission. So please go ahead.
Chair, Regional Director, Excellencies, colleagues, I deliver this statement by the European Commission on behalf of our keynote speaker from Monday, Sandra Galina, building on and aligning with the EU statement delivered by Czechia just a few minutes ago. The European Commission welcomes the draft roadmap to accelerate the elimination of cervical cancer as a public health problem in the WHO region 2022 to 2030, as well as the related resolution. The objectives of the roadmap are fully aligned with the approach by the European Commission, which in the Europe Speeding Cancer Plan included a flagship action of eliminating cervical cancer and other cancers caused by human papillomaviruses. The aim is to vaccinate at least 90% of the EU target population of girls and to significantly increase the vaccination of boys by 2030. Implementing actions are already underway with the imminent kickoff of a joint action with EU member states and a complementary action grant to civil society organizations to improve HPV vaccination uptake in EU member states. Further political momentum will be added in 2023 with a Commission proposal for a Council recommendation on vaccine-preventable cancers. This month, the Commission will adopt a proposal for a new Council recommendation on cancer screening, which will update the existing recommendation covering, amongst others, also cervical cancer screening. The Commission is also launching work with WHO's IARC to update the EU guidelines on cervical cancer screening and treatment. Further EU support to member states to implement screening programs is currently being considered. The Commission anticipates that through ongoing and future actions, there will be over €100 million of EU support invested in cancer screening. In addition, the Cancer Plan's flagship initiative to create an EU network of comprehensive cancer infrastructures will address issues concerning access to high-quality cancer care, including palliative care. Through the Cancer Inequalities Registry, whose first phase was launched in February this year, there will be systematic monitoring of cancer screening programs, as well as cervical cancer incidence and mortality. This monitoring will take into account national and regional disparities, as well as socio-economic differences. In conclusion, jointly with efforts at member state level through EU action outlined in Europe's Speeding Cancer Plan, as well as the Horizon Europe Mission on Cancer, the Commission is confident that the WHO roadmap will be instrumental in accelerating the elimination of cervical cancer as a public health problem in the WHO European region. Thank you.
But please could you wrap up? Okay.
If you can just take a look at the time, please. Okay. Donc,
right, very well.
Merci beaucoup.
Thank you very much. And now we will move on to UNFPA, delivered by the Regional Director, Florence Bauer.
Mr. Chair, thank you, Excellencies. I would like to congratulate WHO Europe Member State Civil Society for developing this roadmap to accelerate the elimination of cervical cancer that we welcome and support. We're particularly glad to see that it is aligned with the principle of leaving no one behind, which is so important in order to address the wide disparities that exist in this region concerning cervical cancer. As we know, this is a larger preventable disease. It is the second most common cause of cancer among women in reproductive age in the Eastern Europe and Central Asia region. And there is a clear evidence that the higher incidence and mortality rate in the region are caused by lack of effective cervical screening program, access to HPV vaccination, and high-quality cervical cancer treatment. UNFPA, with WHO and other UN agencies, has been supporting global and regional level to address these challenges through the development of regional strategies that have provided support at the different country level. 2030 is approaching very fast, and we have a unique opportunity to eliminate cervical cancer in the European region. For this aim, we need sustainable financing from international and domestic financial resources, technical networking and capacity building to advance the quality of service, and cooperation between the countries of the European region to enable exchanges of knowledge and technologies. Ladies and gentlemen, this is a moment where we really count on your support to make this a moment where we can eliminate cervical cancer in the European region. Thank you very much.
Thank you very much. And we have seen that Turkey has requested the floor. Turkey, please go ahead.
Thank you, President. I'm so sorry to taking the floor in the very constrained time for the second time, but I have to correct a misunderstanding. My comments was on the resolution for revision 1, but we were discussing the revision 2, so Turkey strongly supports the draft resolution as written in the revision 2. Thank you, His Excellency.
Thank you very much. Duly noted. So now finally, a joint statement on behalf of 8 NSAs delivered by Peter Baker from the European Cancer Organization. Please.
Thank you very much. I'm very pleased to be able to highlight the joint statement made by the European Cancer Organization on behalf of 8 non-state actors. The roadmap for the elimination of cervical cancer in the European region is undoubtedly a big step forward in public health. We would highlight and commend the commitment to HPV DNA testing and self-sampling, which will help to improve screening uptake. The European Cancer Organization and the statement's co-signatories believe that WHO Europe should bear in mind 3 important measures that will support effective implementation. First, there should be the closest possible alignment between the roadmap and Europe's Beating Cancer Plan. This contains the vital goal of eliminating all the cancers caused by HPV, not only cervical cancer. Secondly, WHO Europe should keep under close review the issue of gender-neutral HPV vaccination. This is cost-effective, will lead to the faster elimination of cervical cancer, especially in countries where female vaccination rates are low, and it will protect males against a range of cancers. Up to 30% of all HPV-caused cancers in Europe are in men. Gender-neutral vaccination also protects men who have sex with men who are completely unprotected by female-only vaccination programs. And finally, we need a whole society approach to HPV cancer elimination that engages not just healthcare professionals and parents, but also civil society organizations, teachers, other key influencers, and of course, young people themselves. The European Cancer Organization is leading an EU-funded multidisciplinary project to support HPV vaccination uptake, which takes a whole society approach, and we have reached out to WHO Europe so that we can learn from each other's experience and expertise. Cervical cancer and wider HPV cancer elimination can be achieved if we follow the evidence and take comprehensive action, including the wide range of measures so clearly set out in the roadmap. Thank you.
Merci beaucoup. Nous n'avons plus de
speakers. So I will wrap up the discussion on this agenda item. I would like to turn to the Secretariat, who may want to provide some comments. Nina, you have the floor.
Thank you so much, Chair, and I would like to thank all the member states for your overwhelming support for the regional roadmap for cervical cancer elimination, support from the partners, the civil society organizations. I would like to, from the Secretariat, to reply that WHO Europe is committed to support the member states through technical assistance and fostering exchange of evidence-based practices and knowledge across the action, and developing the regional focal points network that will help us to drive the elimination agenda forward in the region. I thank you again for being present and for your strong support for this regional roadmap. Thank you.
Merci.
Thank you very much, Nina, rather. We can now take a look at the proposed resolution. You can see the reference here on the screen. Could you bring that up on the screen, someone? I would like to turn towards the committee to ask whether we can approve this resolution. Are there any objections? I do not see any objections. Therefore, I take it that the resolution has been adopted on a consensus basis. Thank you. I would like to give the floor to Czechia, please.
Honourable Chair, Excellencies, colleagues, I speak on behalf of the European Union and its member states. The EU and its member states are committed to eliminate cervical cancer as a public health problem in the European region. We need this roadmap to achieve this, and it is our responsibility to make sure governments have it available. However, we can only ensure united adoption if we are able to negotiate and to hear each other's views. Only then we can put our differences aside and reach consensus. This opportunity was not achieved. Unfortunately, we have reached the point where we lose a very rich and comprehensive resolution text that was the combined and very significant work of both the Secretariat and Member States. We are greatly concerned by this, as the text lost references to essential evidence-based aspects in the response to cervical cancer, in particular in prevention of the risk on human papillomavirus. As per the new European Consensus on Development, the EU remains committed to the promotion, protection and fulfillment of all human rights and to the full and effective implementation of the Beijing Platform for Action and the Programme of Action of the International Conference on Population and Development and the outcomes of the review conferences, and remains committed to sexual and reproductive health and rights in this context. Having that in mind, the EU reaffirms its commitment to the promotion, protection and fulfillment of the right of every individual to have full control over and decide freely and responsibly on matters related to their sexuality and sexual and reproductive health, free from discrimination, coercion and violence. The EU further stresses the need for universal access to quality and affordable comprehensive sexual and reproductive health information, education, including comprehensive sexuality education and healthcare services. These aspects were very limitedly referred to in the resolution and the roadmap itself. For this reason, we very carefully drafted a proposal to add it to this resolution text. We remain our position in this regard. Despite we lose it in the text, it should not be forgotten. Thank you.
Thank you very much to Czechia. I therefore declare this agenda item closed.